Today, when a woman gives birth, she may go to a hospital. There are doctors, there are nurses, there are clean rooms, there are medicines, there are machines that can check the baby. But thousands of years ago, none of that existed. No hospital, no ambulance, no doctor in a white coat, no modern medicine. So here's the scary question. How did ancient women give birth without hospitals? For ancient humans, childbirth was one of the most dangerous moments in life. A woman was not just bringing a baby into the world. She was fighting for her own life too. And the baby was also fighting to survive. In a cold cave, a small hut, or beside a fire, birth was a serious event. Everyone knew it could end in joy, but everyone also knew it could end in tragedy. So ancient people had to prepare the best way they could. The first thing ancient women needed was not a hospital. It was help. Most ancient women probably did not give birth completely alone. Other women helped them. Mothers helped daughters. Older women helped the younger women. Women who had already given birth knew what to do. They understood the pain. They knew when to wait. They knew when to give water. They knew when to calm the mother down. In many ancient groups, childbirth was probably women's knowledge. Men might protect the camp. They might bring firewood, water, or food. But the people closest to the mother were usually other women. They were the ancient midwives. They did not have medical degrees, but they had experience. And in the ancient world, experience was powerful. Before the baby came, the group had to choose a place. The place needed to be warm. It needed to be safe. It needed to be away from danger. A cave, a small shelter, a hut, or a protected corner near the fire could become the birthplace. Fire was very important. Fire gave warmth. Fire gave light. Fire kept animals away, and fire made the place feel safer. Imagine a dark night, cold wind outside, wild animals in the distance. A woman is giving birth on animal skins near a small fire. One woman holds her hand. Another woman brings water. Someone else keeps the fire alive. That was the ancient hospital, not a building, but a small circle of people trying to protect life. Cleanliness was another problem. Today, we know germs can cause infection. Ancient people did not understand germs the way we do, but they still noticed something important. Dirty wounds could become dangerous. Bad smells could mean sickness. Rotten things could make people ill. So they probably tried to use the cleanest things they had. Clean water. If they had it, fresh leaves, animal skins, cloth made from plants or leather, smooth stones, sharp tools made from bone, shell, or stone. Was it perfect? No. Was it risky? Yes. But ancient humans were not stupid. They watched. They remembered. They learned what seemed to help people survive. Pain was another huge problem. There were no modern painkillers. No hospital bed. No injection. No emergency room. So how do women handle the pain? They had to use position, breathing, support, and endurance. Some women may have squatted. Some may have sat. Some may have leaned against another person. Some may have held a rope, a branch, or someone's arm. Lying flat was not always the only way. The goal was simple. Help the baby come out. Help the mother stay strong. The helpers might speak gently to her. They might say, breathe, stay strong. The baby is coming. We are here. That emotional support mattered. Because fear can make pain feel worse. And in the ancient world, fear was everywhere. There was another big danger. Blood loss. If a mother lost too much blood, there was no blood transfusion, no surgery, no modern emergency care. Ancient helpers could only do simple things. They could press cloth or skin against bleeding. They could use plants they believed helped. They could keep the mother warm. They could try to keep her awake. But many times, they could not save her. This is why childbirth shaped human history. Every baby born was a miracle. Every mother who survived was precious. And every experienced older woman was extremely valuable to the group. After the baby was born, the work was not over. The newborn had to breathe. The baby had to stay warm. The mother had to hold the child close. Skin warmth was life. Milk was life. Protection was life. A baby could not survive alone. Human babies are weak compared to many animals. They cannot walk. They cannot run. They cannot find food. They cannot protect themselves. So the whole group had to care. The mother gave milk. Other women helped. Older children watched. Men protected the camp. Everyone had a reason to keep the baby alive, because one child was not just one child. That child was the future of the group. But what if something went wrong? What if the baby was turned the wrong way? What if the mother became too weak? What if birth took too long? This was the terrifying part. Ancient people had very few options. They could wait. They could help the mother change position. They could pray, chant, or perform rituals. They could use herbs they trusted. They could call the oldest, most experienced woman, but they did not have modern surgery. They did not have safe C-sections. They did not have antibiotics. So many births were dangerous. This is something we should not forget. When we think about ancient humans, we often imagine hunting, fire, caves, and wild animals. But one of the greatest survival battles happened quietly. Not on a battlefield, not during a hunt, but beside a fire, where a woman tried to bring a baby into the world. Ancient women were incredibly strong. They carried babies while gathering food. They worked while pregnant. They walked long distances. They survived cold, hunger, fear, and pain. And then, without hospitals, they gave birth. Their survival helped build every generation after them. Without ancient mothers, none of us would be here. So the next time we think modern life is hard, remember this: there was a time when giving birth meant trusting fire, family, courage, and experience. No hospital, no doctor, no machine, just a mother, a baby, and a small group of people hoping life would win. And somehow, again and again, life did win. That is how ancient women gave birth without hospitals,